Okay, so sorry about the 5 minutes. It's a 5 minutes, 6 minutes that it took me to get started. It just takes me a little longer with the Zoom and the Facebook, trying to make sure everyone can see me. I'm so excited for tonight. If there's any time that you can't hear me or something is going on, just put it in the chat. So you're not able to unmute right now just because I want to make sure that everyone gets a really good experience. And so we're going to dive right in. My name is Dr. Sapphire Boone. And tonight we're going to go over strategy. I know you guys are so excited. I'm excited. I'm a 3-time grad from Morgan State University. I live in Baltimore, Maryland. I have a PhD in social work, and I'm so excited about licensure prep. I've been teaching licensure prep for the last 7 years. Part of my full-time job is to make sure that my students pass the licensure. So I wanted to take those skills and my expertise and spread it all over the United States. So I'm excited. My information that you're going to be getting tonight is for all levels of licensure. So whether you're doing the associate's level, bachelor's level, master's level, clinical level, advanced generalist level, it's for all of it. Now, when I do my classes, my content is geared more towards the master's level. But as you know, the content overlaps, okay? So it's okay if for that, but for the strategy, it's going to work for all test levels. Okay, so let me pull my chat up, make sure everybody's okay. Okay, it works. Okay, great. I will post the, let me see, can I do it really quickly? So tell me a little bit about yourselves. Is anyone testing soon? I know I have some that were with me last week. Did anybody start studying since last week? Did you develop a routine? Are you excited? Are you not excited? Okay, you're testing November 13th. Great. Anybody else? Is it coming up? December 7th. Okay, great. Second time. Oh, it's coming in fast now. Okay, testing soon. Okay, started studying last weekend. Okay, great. You're still nervous. That's okay. So I'm putting in the Facebook chat the link for the presentation that I'm doing tonight. October 30th. Oh my goodness, Elizabeth, it's gonna be okay. You're gonna be okay. Okay, so I'm gonna do a little plug for those who are nervous and have anxiety. So I want you to relax. Okay, you need to be relaxing. You need to be confident. So the whole point of tonight is to make sure that you are confident in what you know and what you don't know. What does that mean? So to be confident in what you don't know means that it's okay when you see something, the question, you don't know the answer, that you're going to be okay within yourself to say, you know what? This question is not going to take me out, okay? Because let me tell you, there's so many times where one question can throw you off. That question that you didn't study, that word that you didn't study can throw you off. So tonight, the strategy that I'm going to teach you is to hope that you will be able to really that you'll be able to get over your anxiety. Oh no, test was canceled due to the hurricane. Oh no. You need to reapply to take the test again. Okay, Patrice, that's okay. Praying to have a routine after this session. Okay, great. If you missed my first session, make sure you have it. But if you were there, I feel like you were there, Miss King. So just make sure that you get on that study routine. Yes. Okay. Less afraid of the book. Yes. The book can be very, yes. Any study material can be very overwhelming. So tonight, what I also wanted to say for those that are regrouping, that this is your second attempt. Yes, Carla, check your mute. Make sure you have your volume up. Because everybody is telling me that they can hear it. So just make sure your volume is up. Make sure when you regroup that you will be having confidence in yourself, okay? But also that you're focusing on strategy. What I tell people that come within 5 points of passing is that it probably was your anxiety, okay? Within 10 points of passing, it probably is your strategy, okay? If you're over 10 points that you missed it by, then maybe what it was is that you need to check how you're studying, and you need to kind of refresh how you're studying. Okay. So just keep that in mind. Okay, job. Hi, Miss Towns. How you doing? Yes. Okay. Yeah. So just it's okay. We're gonna go over the strategy tonight. And what I wanted to tell you about this strategy is that you're gonna have to practice it. And I also wanted to say a little bit about acronyms. Acronyms, it's not a one size fit all. So some people feel like they have to have an acronym. Okay. Hey Raven. And some people feel like the acronyms make it worse. Okay, so I've had people say, well, I did the acronym, I wasn't sure which question to apply it to. So the liked method can be used for every single type of question except for definition, because you either know it or you don't, right? It's no processing. Any question that you need to process and do a process of elimination, the liked method is going to be your number one. Oh no, video interrupted. The method is called the liked method. I'm going to put it in the chat on both. And it literally is just a process for how you eliminate. So last sentence first. Identify the type of question. K is key concepts. E is eliminate. I'm visual, so I literally have to write it out to remember what it's for. And D is for distractor. Okay, so like last sentence first, identify the type of question, key concepts, eliminate 2 answers, 2 wrong answers, and then the distractor. I'm gonna put that on last sentence first. Identify the type of question. Eliminate 2, no, key concepts. Eliminate 2 and distractor. Okay, so put in the chat what kind of acronyms do you use or have you used in the past? Did you like them? Did you not like them? Some of those acronyms, like the safety acronym, is specific to safety questions, right? So they are good for safety questions. So just keep that in mind. Okay, so this is none of them. Yeah, some of them. Yes, Farm Grist Road, I've heard about that one. Safari, I call it Safari. Saul's Harms, haven't heard about that one. Let us know what that means. Yeah, I haven't heard about that one. Okay, learn the strategy. They weren't helpful to me. Got it. But yours is my fave. Okay, let's go over it. So read the last sentence first. You want to pay attention to indicators such as first, next, best, most, primary, least, not. You want to pay attention to those indicators because each indicator will dictate what kind of answer you're going to get. And tonight we're going to see how 2 exact questions with 2 different last sentences change the answer, just to give you a good perspective on what I'm talking about. So you want to read the last sentence first. Why? Because a lot of times you guys read this paragraph 5 times in a row, and you might still not know what really you're supposed to be asking about, right? So let's pay attention to the indicators. Step 2, or the I, is identify the type of question. What type of question is it? And what I say, because some people get caught up in not knowing what type of question it is, it brings anxiety to some. So if this is you, then what I would do is don't worry about what type of question it is. Just focus on what is the main issue. Write that down, okay? Even if you don't know what type of question it is, you should be asking yourself, well, that's 3. What is the main issue? Okay. Oh, the questions were short and vague. Okay. Yeah, so keep that in mind. Types of questions, example of types of questions would be safety, human behavior, ethics, diagnosis and medication, direct practice questions, which are very general, group questions, community questions, administrative questions, research questions, and the list goes on and on and on, right? Diversity. I mean, it's so many different types of questions. So that's why I said, don't get caught up in it, because a lot of my clients are like, I don't know what type of question this is. Normally it's a practice question, but you really want to make sure, is it a safety question? Because a safety question requires a safety answer. Is it a diversity question? Because a diversity question requires a diversity answer, right? So you just want to make sure that you have that straight, right? So L, last sentence first. I, identify the type of question. Key concepts. That's what I mean by main issue. With a 5-sentence question, you probably only need to know about 2 sentences out of the 5, right? And so the reason why you're going over and over and over and over, right, is because you are trying to figure out what the main issue is. So I hope, that's why I said that this method takes practice. It takes practice for you to recognize that this is the main issue. So practice makes perfect. But what I will say is that this strategy helps you to not just be haphazardly reading the question. So you're going to eliminate 2 wrong answers. And sometimes your 2 wrong answers will be different than my 2 wrong answers. And sometimes that's okay. And then sometimes there is a right wrong answer, if that makes sense. And I'll let you, we'll go through it and you'll see what I'm talking about. And then what is the distractor? Typically you get it down to the last 2, right? One's the right answer, hopefully, and the other one is not. So what I typically say about once you get it down to your 2 answers is to remember what type of question it is and what are they asking, right? Is the question about you as a social worker? It's going to be a different answer than if the question is asking about what you should do for the client, okay? So you want to keep that in mind. Okay, so this is an example of a question. So I'm going to do the method, and then I want you to kind of pay attention to how I go through it. The social worker should. Okay, with the social worker should, we don't have any indicators. The social worker should could mean this is what I should do first, or it could mean what should I do in general, right? So it just kind of depends on the answers, really. So a lot of times, and what you're going to ask me tonight is, well, in what case could it be answer A, right? And it all depends on our issues in the question, right? And it also depends on what the answers are, right? So I can't tell you that every time, I can't tell you that every time that this is going to be the answer. So what I don't want you to do is memorize every question that you see. So you're going to say, okay, every time I see prospective adoptive parents, the answer is refer the clients to CPS, right? No, that's not what I want you to say. But what I want you to say is, this is a safety question and I need a safety answer, right? That's the principle of the question. So you're going to read the question. A social worker is working with prospective adoptive parents. That's important. And the 12-year-old child in their care pending completion of adoption. Typically, the age of the child could be important or sometimes it's not. So it just depends on what they're asking. The parents describe the child as stupid and an idiot. Oh, in the child's presence, despite repeated suggestions to discontinue these negative comments. Okay, so you have to think about, one, we're talking about adoption. And before we want any parents to adopt any child in foster care, okay, then we need to make sure that the child is safe. So for the most part, when you see a child welfare question, I want you to think safety, but then I also want you to say, where is the safety issue? We have a safety issue because they are emotionally abusing this child. They're calling the child stupid and an idiot. And although emotional abuse is not really popular, we don't see it a lot, it is a safety issue and it's a child abuse and neglect issue, okay? So we're going to then, so we identified the type of question. It's a safety child welfare question, right? Our key concepts are highlighted in teal. So all the questions we go through tonight, you're gonna see the same colors. So the teal is what you need to pay attention to. This wasn't very long, but these are what you need to pay attention to. So now that you know that even though you've told the parents to stop using these negative comments, they continue to use them. What are you going to do? What should you do? And should means, what should I do according to the knowledge I learned in school, according to my study guide? Not according to Sapphire Boone, the child welfare worker that works in Baltimore City DSS. That is not what I should be basing my answer on, okay? So you have to take your experience out of it. The test doesn't care about your experience, okay? All right, so I eliminated A and B. Refuse to work with the parents unless they follow the recommendations. Okay, no, we're not gonna do that. Refer the clients to anger management classes. We're not going to do that because it really doesn't address the safety issue, right? So the issue is really about the child. We want to make sure the child is safe, right? So what do we do to make sure the child is safe? Continue to educate the parents about bonding with older children. I mean, that sounds really social worky, but it has nothing to do with the main issue. Remember, our main issue is safety, okay? So refer the clients to child protection agency due to possible emotional abuse. Bing, bing, bing is going to be our answer. And you had to interpret that stupid, calling the child stupid and an idiot equals emotional abuse. So you had to keep that in mind. Any questions about this question? Is this clear? What about how we went through the question? Let me know. What are you guys saying? Let me look on Facebook too. Shout out to my husband that's watching and shouted me out. I hope you guys are there on the live on Facebook. I hope it's working. Clear. Okay, it's clear. This one is clear. Okay, you're not talking to me on Zoom. Is it still working? Okay. The chat box is still working. I was a little concerned. Okay. So what we're going to do now, we're going to take a little pause. It's clear to me. Okay, great. So what we're going to do now is we're going to take a little pause, because what I want you to do is I want you to take this poll. We're going to do 10 questions on the poll. Whether you're on Facebook or on the Zoom, I'm going to give you the link to the poll. I haven't started the poll yet. Well, let me start the poll first. Let me start it. Okay. And then I'm going to give you the link and you're going to answer the question on your own. Okay, you're going to answer the question on your own with this link. Let me get the link to the folks in Facebook land. Hold on one second. If it's up, go ahead and start. You can go ahead and start it. I want you to go ahead and answer the questions. First, let me know if the poll is working. I just put it up. If you're on Facebook, the link is in the questions. It's working. Okay, I got one person says working. Hopefully it's working for everybody. Okay, so what I'm gonna also do is I'm going to put the question on chat. So if you don't want to use the polling site, then you can use it you can answer on the chat box, but I'm going to disable the chat box so that you don't distract everyone else. Oh, how do I get to the poll? Here's the poll. I put the poll in the Facebook one more time, and I'm gonna put the link one more time. This is the hardest part, guys. After this, we're gonna be flowing quick. Let's see if I can. Okay. Okay, I'm gonna disable the chat box on Zoom just so that we can get to the next question. Okay, this is question number 1. Let me disable the chat. Okay, you have 20 more seconds to answer the question. All right, time is up. If you haven't answered the question, go ahead and put your answer in. It looks like most people got it right. Okay, the answer is actually going to be, before I reveal it, let's go through the steps before I reveal the answer. Okay, let me see what you got on Facebook. Okay, so the best course of action. The best course of action implies that there are multiple answers that are correct. Okay, like all the answers, right? They all seem correct at first. So there are options that could be correct, but we want to know what is the best course of action according to the information that we have. The other thing I want you to know is that I want you to pay attention to the second to last sentence. Is it always going to give you the answer? No. But for those that get lost in the question, maybe focusing on this may be very key. So you want to focus on the age of the client, a 13-year-old male, and you also want to focus on the presenting problem. Okay, so our client is isolated, having difficulty concentrating. Okay, but that second to last sentence says he's afraid to tell his parents and does not want them to know that he's in a relationship with another boy, right? So what is the best course of action? The best course of action, because our client is afraid to tell his parents. Okay, so before we get to the answer, tell me, what did you eliminate? What are the 2 answers you eliminated? Tell me on Zoom and Facebook. What 2 answers did you eliminate first? Okay. We are definitely going to eliminate. Let me see. What are we definitely going to eliminate? We're definitely going to eliminate. Well, let me just pull it up. We're definitely going to eliminate D, discuss safe sex practices, because that really has nothing to do with the question. Okay, it sounds really social worky. We may need to do that, but he hasn't even talked about that he had sex at all. So why are we talking about safe sex? He did not mention anything about safe sex. So why are we trying to discuss this? Okay, so that's the first thing. We're going to get rid of D, as in dog. Okay, has nothing to do with the question. A, advise the youth that all the information that is discussed in the session will be held in confidence. Why would A be incorrect? Because A, we never say that, right? There are situations where we would have to disclose what they said, right? So we can't say that all of the information that is discussed in the session will be held in confidence. That actually goes against the code of ethics. So we got rid of D because it has nothing to do with the question, and we got rid of A. Let's backtrack a little bit. This is just a practice question. So just to let you know, it's a practice question. So if you got rid of other things besides A and D, it doesn't necessarily mean that you're wrong, but it just means that I want you to process it a little differently, because that means, like, if you got rid of A and B, you might have picked the wrong, you might pick the wrong answer if you don't get rid of the ones that are definitely not it. So when you are eliminating, don't say, oh, A, no, oh, B, no, oh, C, no, D, okay, maybe. Don't do that. I want you to eliminate what you know for sure it would never be, or it is not going to be that. So we would not be talking about safe sex because it had nothing to do with safe sex in the question at all. It doesn't even say that he's having sex, okay? So we're going to get rid of D. And A is actually incomplete altogether. I mean, incorrect altogether, okay? So for this one, you need to get rid of A and D. I want you to get rid of those. Okay, let me see. I think I saw somebody say something. Maybe I did. Okay. We are not trying to have him tell his parents if that would be unsafe. Yes, thank you. So we got it down to B. So B is our distractors in yellow. And C as in cat is the answer. We like explore. So for this one, explore was right. So scheduling a family session like was just said on Facebook, we are not trying to have him tell his parents if that would be unsafe, right? If he's afraid, we're not going to do that. Now, the reason why I said best course of action. Yes. Yes, Chastity. We assume, don't assume. Okay. So the reason why it's the best course of action is because maybe in the future you might do B after you've done some work with that client and after they're ready to meet with their parents, right? And you would be there to support the youth. That sounds very good. But C is going to be the best course of action for the situation that we currently have. Do not think in the future. Like a lot of times we are like, okay, well, this is how the client is going to react to this answer. So that's why I picked that answer. Or I didn't pick that answer because I'm basing it off of how the client is going to respond to me. That is not how we do social work on this test. You're going to respond to the situation. You're not going to respond to the client's response that we don't have in the question. Okay, intimate relationship. So you could have assumed that meant that they were having sex, but an intimate relationship could just mean they're like together, right? It just means like they are in a committed relationship, And even if you did take that as sexual, he didn't say anything about he needs help with safe sex practices, right? It didn't say that. So as a social worker, we like to help, right? We like to help everything, but you have to be focused in what it's asking you to help with. Okay. It's trying to tell you that second to last sentence, he's afraid to tell his parents. So we need to figure out, why is he afraid to tell his parents? Right? That's what we should be responding to. Not that he's in an intimate relationship. That's not what we need to respond to. He can be in an intimate relationship with another teenage boy. It's nothing wrong with that. We don't really need to talk about that. Right? Now, if it says something about something that was unsafe in terms of him being in this, relationship that could be possibly sexual, then maybe, right? But it didn't say any of that. Okay. Would we need to disclose and break confidentiality after exploring his fears because he's a minor? Okay. I would say, and I'm going to give this disclaimer because I'm not a clinical social worker. So when you ask me things, what will we do in real life? I partially know the answer. Really, you guys are the more expert on what we would do in real life than me. Okay. I'm here to help you with test world. So real world, we can poll the audience because you guys are doing the work, right? I'm just going to give you my perspective that we would not need to disclose this to the parents because it's not one of those things that are disclosable, right? He's not saying that he is unsafe. Now, maybe if this relationship was with a 25-year-old male and we were worried about, statutory rape, then yes. But because there's no unsafe nature, then we don't need to tell the parents anything, right? Okay. We're going to move on. Any questions about this? Any other questions about this question? Okay, real world, not disclosable. Thank you, Tony. Yes, I'm going to poll the audience every time because I do child welfare. I don't know how to do any other practice with child welfare. But that's the beauty of the test. You don't, wait a minute, before you start, wait a minute. That's the beauty of the test is that you don't need to know how to actually practice with any of these populations. You just need to know what the test wants you to do. Okay, that's what we're going to focus on. All right. Okay, we're up to question 2. Let's go. I'm putting my timer on. Okay, I'm going to open up the chat. I didn't send a different poll. It's the same link. So we're going to use the same link. So go ahead and keep that same browser up. And then it'll just change the question. So same link. Let me put the link back up. Oh, sorry. Same link. But if you miss the link, then it's okay. You can just answer on the chat. It's no problem. All right. You had this on your test. Yeah, when you guys tell me different things that you saw, I try to make questions. This one is super tricky. Yes. Okay. This is tricky. And let me tell you why this is tricky. Because working with the LGBTQ plus population may be an area that you might not have a lot of experience with. And so when you see certain questions, you get scared. So what I'm going to do, I wrote it down on my notes, is I'm going to, when I upload this recording to YouTube, I'm going to also attach 2 links to terms. So a way to help you with your anxiety on populations you're not familiar with is to get familiar with terms. So for example, one client told me she had cisgender on her test. She's never heard of that. And so that's okay. You guys just need to get familiar with the terms and make sure you know, okay? So I'm gonna put that in the description section of my YouTube. I'm gonna upload this recording to YouTube tomorrow and put all of the links that come up tonight, okay? So someone tell me what kind of question this is. Somebody tell me. Anybody? What kind of question is it? Yes, diversity, yes. Perfect. It's a diversity question because we have a diverse population. And sometimes they'll put diverse populations in the question. Like, for example, they may say, they may describe the client, which puts them into a diverse population, but the question has nothing to do with their diversity. Okay, so keep that in mind. Again, sometimes the question will mention their a diverse description of a client, right? Their race, their nationality, their religion, whether they're part of the LGBTQ plus population. But your job is to make sure that the diversity has something to do with the question. So in documentation, right, we want to make sure that we are using the pronoun that the client uses. Even though it says that we have a transgender client, we want to make sure that that's the pronoun, whatever pronoun we use in our documentation should be the one that they use. Okay. So keep that in mind. You could have picked A, but it's really D. Let me look at the results too. That's what I meant to do. Okay, we got 80%, right? 80% said, I'm going to pick D as in dog. We did have a couple pick A, which was the distractor. We had 1 or 2 pick non-binary. So we just can't subscribe our clients to anything, right? We just need to either ask or go with what they're identifying as, okay? Yes, respect their pronouns. Thank you, Rhonda. Yes. Okay. This almost tripped me up because it says documentation. Okay, like would the client see the documentation? That's a good question, right? So it's not asking whether or not the client is going to see the documentation, but what we're saying is that we want to respect the client even in our documentation, even if they never see it, right? We want to respect our client and address them as they prefer, okay? And it's really an ethical thing as well, right? Ethically, we need to be documenting in such a way that respects our client, right? Yes, ask him how they want to be identified. Perfect. It could have said that as well. This one almost tripped you up. Okay, don't worry about yesterday. That's okay. Don't worry. It almost tripped you up, but it didn't. Lots of distractors. Yes. Second sentence was a distractor. Oh, it was? Okay, let me see. Second sentence. An emergency position was completed due to the client being violent. Oh, yes. Yes. Thank you. Thank you for that. Tony. Yes. Thank you, Tony. So I put that in there. I threw just random description. So really, we don't care about the fact that he's violent. Or here, I'm sorry, I said he. See, shouldn't do that. Whatever pronoun we're going to use, we're going to respect the client's pronoun. So we should not be concerned about the client being violent because the question did not ask us anything about the client's violence, right? So that distracted us. We don't need that. We don't need that sentence. The only thing we need is that we have a transgender client. That client is a part of a diverse population, and what answer is going to respect or consider their diversity, right? Okay. All right. I think we can go to the next question. Let me go to the poll. We're going back to the poll. Open up your browser to the poll, and we're going to question 3. And it's on the screen. Okay, time is up. Go ahead and put your answer in the chat box. If you didn't vote already, vote for your answer. Put it on Facebook. Let us know. Yeah, over 90% of you guys got it right. So even though you got it right and you did really good, I'm so excited for you. I want you to tell me what were your key concepts? Tell me, what were your key concepts? What did you need to pay attention to? Key concepts, what were they? 8 months. First, oh, thank you. Yes, I didn't talk about first yet. Yes, 8 months. Her depression began 8 months ago. Great. Onset of symptoms. Yes, we need to know when did they happen, and sometimes we need to know what their symptoms were as well. If we're doing a diagnosis question, we would need that, but we know we're not necessarily diagnosing. We just need to consider what's going on, right? Yes, depression, loss, and time. Yes, just found out the loss. Perfect. So, what type of question do you think this one is? What's the type of question? We know that there's a loss. We know that there's some symptoms in our question. Safety to explore human behavior. Okay. Reasoning, diagnosis and medication. Okay. So I would say that this is a practice question. And I would say that we need to, because it's asking first, what will we do first? We have this situation where we're dealing with depression, that we need to make sure we know what stage of practice we are in. So somebody give me the stages of practice. You didn't know, you were here for a lesson, I know. So the type of question I would say is a practice question. And I want you to tell me what stage of practice, well, give me the stages of practice. What's the helping process? It's okay, Tony. We're going over it right now. Okay. Engage. Yep, that's the first one. Yep. Engage. Give me some more. Assess. Yep. Engage, assess, plan. Yes. I don't see intervene yet. Okay, intervene. Right? Okay, intervention. Yes. Termination. Yes. What comes before termination? Monitoring, evaluation. Yes. Okay. So our stages of practice are engage, assess, plan, intervene, evaluate, and terminate. That's 6 things. I know there's an acronym for it. Something about, I forget the acronym, but it's an acronym for it. You need to know what the stages of practice are. Okay. So if you don't know how to tell what type of question it is, just say it's a practice question. Eat pie today. Thank you. I knew it was something. Okay, just say in your mind it's a practice question. The questions you really need to be concerned about are like safety questions, ethical questions, and we'll get into some of those. But let's just say every question is a practice question. It's okay. What is the main issue? So you told me the main issue. You said the client has depression. It started 8 months ago, and she had a loss 9 months ago. Okay. And we're asking, what should the social worker do first? Okay. First means that there are other steps that come after the first step, right? So I want you to put the answers in order according to our stages of practice. Engage, thank you. Engage, assess, plan, intervene, evaluate, and terminate. Okay. So somebody give me, we're going to do that in the opposite order, right? Because we're eliminating the wrong answers. So out of these 4, what would we do last or not at all? Really, this is probably why you got 90% right. Okay. Last or not at all. Okay. Homework. How are we giving homework and we have not assessed yet? Okay. So when first of all, we're in the assessment stage. Okay. Right. Because we will refer to client and we're given this information and we need more information about what was just given. Right. So we're not going to give homework yet because we're not working on anything yet. Right. That would be a intervention and we don't need interventions. Okay. So we're going to get rid of A. We're going to also get rid of B. Yes. We're going to get rid of A. Yep. Really, it's A, B, and C, right? Because all of them are actually interventions. A, B, and C are interventions, and D as in dog is going to be the answer. Yes. C, what? Hold on. Sometimes I do this and I'm so sorry because I try not to make this answer the same every time. So the answer might be different on the question. The answer is ask about the meaning of the loss of the baby. So I do apologize that on this slide it was D and then on this slide it was C. So sorry, that was confusing. I'm so sorry about that. I tried to catch all of it, but I'm a human, I have errors. The main thing you want to know is give, offer, and refer are all interventions. And ask about the meaning of the loss of the baby to the client is the answer, whether that was C or D on your screen. Okay. Okay. Why is that important? Because this is a trigger, right? So when we have this symptoms, we want to figure out where did the symptoms come from, right? A biopsychosocial, we're trying to get the history, right? So we just got some information about the history of a client that could be the reason why she has depression. Okay. So I'm going to say this again. When you see, and I do agree with some people that put diagnosis and medication, right? Because the depression is something we need to know. We also need to know that when we have a client with a diagnosis, that we need to do an assessment, a comprehensive assessment. So unless the question gives us information that we are at the intervention stage, then we should be assessing. So what do our answers represent? 3 of them represented intervention and only one of them represented assessment. So you can see why every time assessment is typically going to be the answer. Unless it specifically states that we need to do some type of action to help the client, that would be some type of intervention, or unless we've already completed an assessment, right? And it would say that in the question. Okay, any questions about this one? Was it hard, easy? Yes, Dr. Pam was in your head. That's a good thing. Can't do anything until we know where the client is at. Perfect. Yes, start where the client is at. That was a good thing. Yeah. I scratched out C because we are the expert. Yes. All right, let's go to the next one. And again, I'll make sure that 3 is corrected. on, not bad, not bad, pretty easy. That one was easy because 90% of y'all got it right. So that's how I know it was real easy. Let's go to number 4. All right, 4A. Okay, I must have chose a lot of easy questions. Oh man. Okay, so someone tell me, okay, what should a social worker do next? So next is like first. Next sometimes means that you are in the moment sometimes. So does first, sometimes they mean in the moment. And then I want you to also put this in order as well. So the type of question, it's okay if you don't know the type of question, but just letting you know, at least know who the question is about. So with your answer, are you answering based upon the clients or are you answering based upon you? That's what you need to determine. So did you guys answer this based upon the clients or you? Yeah, okay. I see y'all were kind of torn with this question. But you got the question right, but you're torn about what's the question about, right? Okay. So, it is an ethical question. So whoever said it was ethical question is correct. And when you ask, how do you know it's about me or how do you know it's about the client? Well, let's look at the question. You're going to typically know with your last sentence, typically. But a social worker conducts a group for teenagers with previous criminal behavior. The social worker repetitively feels angry during sessions. Anytime you see your feelings noted in the question, you're going to ask yourself, is this question about me as a social worker? I'm going to say 8 times out of 10, you want to address your feelings some kind of way. Yes, countertransference, Tasha, you get points. Yes, countertransference, right? So that's how you would know whether it's about you or not. So 2 things. If it mentions your feelings, you're going to want to make a note that this might be about my feelings. What do I do about these feelings? Okay. And then 2, you want to see, what does the last sentence say? It just says, what should I do next? It doesn't say something else we're going to see in the next question. I don't want to reveal it. Okay. So the answer is A, because there were only 2 answers that addressed your feelings, and A was the correct answer. Supervision. When I have countertransference, I need supervision. So I'm going to also put in the description of the YouTube for the recording tomorrow is, when do I seek supervision? Because there are various situations where you're always going to want to seek supervision. It doesn't mean that seek supervision is always the answer, but yes. I always identify the person in the hot seat. I love that. To determine who to address in the answer. I love that. Yes. And when should you know whether you're in the moment is that's going to be a good way. Who is the question about? Okay, I won't say who is the question about. The main issue in the question, who is that about? Okay, and you'll know what the main issue is by the last sentence. Okay, all right. Let's go to this question. I call it 4B because it's the same question, but it's a little different. So we did good on that one. If you're not clear about something, make sure you pause me so that I can give you clarity. But most people got it right, so we're gonna keep it moving. Okay, we're gonna go to 4B. Okay, go ahead and put your answer for 4B. It might say 5 on the actual poll. But I wanted to answer Isabel's question about groups. She said, I thought when social workers had to express feelings, they should express them in the group first. Okay, but we know that there's not a time where we should express feelings if it's not therapeutically appropriate. Expressing our anger is not therapeutically appropriate. Okay. You want to bring the feelings to the group first when it's the group members that have feelings. So let's say the group members feel like the last session they didn't feel heard. Then at the next session, you're going to bring those feelings to the group first, right? But this wasn't about the group. This was about you, right? So when we have countertransference, there's really no time where we should be sharing our countertransference with our clients, because then the therapeutic relationship now looks like they're helping us because now they're trying to help us with our angry feelings, right? So that is not appropriate. Okay, so some of you may ask, this is the same exact question. Tell me why this is not the same exact question. Tell me what changed in this question. Let me look on Facebook. Let me not leave my Facebook people out. What changed in this question from the last one? Yes, it's on the client. So I wanted to show you the same question, but that last sentence is different, right? So this one said, what should the social worker do next about my feelings? That's what I determined was the main issue. This issue says, what is the best action to help the client? So that means despite how I feel, how should I be helping my client, right? So the focus is now, okay, well, who is my client? Okay, I have a group of teenagers with their criminal behavior, and now my focus is different. Yes, now we're asking about the client. What is the best way to help the client? That means our feelings we don't care about our feelings. This is when seek supervision is not appropriate, when the question is not asking about us. That's when it's not appropriate. Okay, So now we shift from the focus is us to the shift is now on the clients bragging about how they hurt people while committing past criminal behaviors. What should we do about that? Well, maybe we should talk about the consequences of them, of their behavior. Okay, so the answer is B as in boy. Okay, is everyone with me? Okay. I'm going to stop sharing just for a second because I don't know why squiggly lines appear magically. So I'm just going to redo it. Okay. Okay, let's go to the next question. Any questions about this? Okay, why not confront? Thank you. Very good question. Somebody tell me, when is it appropriate to confront clients? Tell me. I changed my answer. No, don't change your answer. No. When is it okay to confront clients? Only when it benefits the client. Okay, I like that answer. Anybody else have an answer? When is it okay to confront clients? Usually with enablers. Okay, I like that answer too. I'm going to put a social work spin on it. When disruptive to other group members. Okay, I like that as well. Safety. Okay, yes, we should confront. Yes, we should definitely not let people be unsafe. When there are discrepancies, Lolita Hope, you are the winner. Okay, so I like everyone's answer, but I want to say that Lolita Hope, she takes the cake. When there's discrepancies in what? In what we said we're going to do, right? The plan or the goal of treatment. And when the client has a discrepancy in their behavior. So for example, we know that when we plan, right? When we plan with our clients, that we get agreement, right? We get agreement from our clients. This is the plan. They bought into the plan. So it will say in the question, that the clients know. I think, did I put it why it's not confront? No, I didn't put it. Okay. The reason why is because it doesn't say in the question that boasting is something that we agree to not do. So I like when someone says break rules in group. That's good too. So when we have something that is agreed upon by either the client or the group, and their behavior is the opposite of what we agreed to, then it's appropriate to confront. So confronting in the test world is a little bit different than in the social work world, because in social work, we confront all the time. But in the test world, confrontation is only appropriate when there is a discrepancy from what was agreed upon to the actual behavior that's being displayed. Does that make sense? That's why it's not A. We're not going to confront the group. If it's stated that we previously stated in the first session that clients will not brag about hurting people or clients will not boast about criminal behavior. Okay, I'm gonna repeat. Okay. You confront, I'm gonna put this in my notes that we need to talk about when to confront. You only confront when you have an agreement, a plan that you guys agreed upon. Rules are typically also agreed upon with groups. Anytime there is an agreement between you and the client, meaning in my plan, it says that I am to not talk negatively about myself, right? And then at the next session, I talk negatively about myself. I'm going to confront that client and say, hey, remember we said you're not going to do this according to our plan, according to the rules of the group, right? That's the only time. In social work, we confront all the time, right? We think confrontation is really discussing, but in the test world, they're two different things. Confront and discuss are not the same, okay? You only confront when there's a discrepancy in what was agreed upon or rules or what was previously stated. And it will say this in the question. Okay, it will say it clearly that this is something that was the client is working on A, B, and C, but then they say, I don't want to do this, right? Yes, it's all about explanation. That's what we're doing tonight. No. Oh, I'm so glad. I'm so glad, Allie, that you brought that up. Yes. Confrontation is not education, right? It's not discussing. It's not education. Confrontation is saying you are doing the opposite of what you said you were going to do, right? So saying you're on board, I'm committed to this group, and then you never show up to the group. Well, I'm going to confront you on you not attending the group, right? You said you wanted to pass the test, but then you're not studying. I'm going to confront you. Okay. Right? I'm going to confront you on that. Okay, let's go to the next one. This was good, right? I like that. That's a principle that we just learned. All right. Okay. Okay, time is up. Go ahead and put your vote on the poll or your answer in the chat or on Facebook. Let me see how you guys did. Okay, not bad. Let me, before I tell you what type of question it is, you tell me. What type of question is it? Recall. Okay, I'll take it. Mm-hmm. Yep. So some people, oh, did I open it up to everyone? Oh, sorry. Yeah. So if you put practice, you're correct, because these are practice models. I say practice models. These are therapeutic treatment. So when we think about practice and interventions with clients, if you want to put it in a category, it would be interventions with clients, right? So if you said diagnosis, that was pretty close. Recall, you need to know what these therapies are. So yes, you definitely need to know the recall. But this would be, you need to know intervention models, right? Intervention techniques. So these are different types of therapy, okay? So you also, I agree with the diagnosis too, because you also need to know what personality disorder are we treating? So someone tell me what personality disorder is described in this question. Let me look on my Facebook. What you guys say on Facebook? What diagnosis is being described? Which personality disorder is this? Yes, Tony. Yes. Yes. Borderline personality disorder. And everyone on Zoom got it right too. Yes. Borderline personality disorder. So the answer is B. So first you need to know that this was describing borderline personality disorder. That was the first thing. And then the second thing you need to know is what therapy is most commonly used with borderline. Now it says most likely. That means that you could do cognitive therapy, possibly. I don't know. I'm not a clinician, right? So you probably maybe could do cognitive. You maybe could do some trauma or group. They might be appropriate, but the most likely to be used, they're connected. There's an association that you need to know. You need to know that borderline personality disorder and DBT go together. Okay. And I put this question up because someone was like, yeah, I had questions about that. I had a question about this. All right. So now you guys see it. You'll know it for the rest of your life. DBT and BPD. Okay. They go together. Yes. Don't second guess yourself. The dialect is the way you talk. So what I would do, because I told you I'm not a clinician, look up the therapy so that you are familiar with it. What is it about? I put that on my notes that I'll put like a little definition of what DBT is. I've never employed DBT. I do not know anything about DBT. Okay. All I know is that borderline personality disorder and DBT go together. That's all I know. Okay. So that's what I need you to know from this question. And this is how I want you to do every single question. Ask yourself, what did I need to know in order to get this question right? Number one, I needed to know personality disorders, right? So when you said this is a diagnosis question, I said, yes, that's right. Because you need to know borderline, that is borderline, okay? I also need to know that DBT and borderline personality disorder, they go together. So I don't need you to memorize anything about this question besides those two things. And what I always tell people is when you get a question wrong, the only reason that it is in vain, a wrong question is a learning opportunity. You need to be keeping a running tab. What do you normally get wrong? So when you see it on the test, you'll get it right on the test. So I would write in my book, DBT maybe borderline personality disorder equals, and I would list the major symptoms. And then I would also say DBT plus BPD, right? I would say they go together. Okay, so those are the two things I would write down in my book. And what I want you to do with this list of things you get wrong is now you have a ready-made study guide for your own self, right? It's a personalized study guide just for you. This is the areas that you get wrong, right? So in the other question, when it was 3 interventions and 1 assessment, you should write assessment first. That's what you should have wrote down. And that's what you should keep in mind, right? Assessment first. Or you need to write down the stages of practice. Let me memorize the stages of practice so that I can recognize it in the question. Okay. All right. That one was pretty good. You guys did pretty good on that one as well. We got over 75. So let's go to the next one. All right, time is up. Go ahead and answer the question. We have 10 total questions tonight, Melissa. Medication questions are not my favorite. It's okay. But you gotta, you always get a few. So just want to make sure you get those few right, hopefully. All right. What do all of these medications have in common? Celexa, Wellbutrin, and Paxil. What do they all have in common? Yep. They are all different types of antidepressants. Yes. Yeah. Antidepressants. So you want to go with a answer that would need an antidepressant, which would be C. So someone enlighten us. How are you guys studying medications? Any recommendations that you guys have? I recommend that you study it by category. It's really no way to really do it besides that. It's no like necessarily shortcut. It just depends on your learning style. Maybe you need to put them in colors, different colors for different categories. These names are actually the brand name, but they do have generic names as well, and you need to know both generic and brand name. Because one client told me she had a generic name for anti-anxiety medication, so you need to know both. Yeah, some people actually just don't study them. I'm not suggesting that, but some people say, "What's the point? I only get a couple." Right? But you might get that test with more than a couple and then you're gonna be mad, right? Yes. Oh, that was good, Kimberly. Remembering the medicines by family members, friends, or objects. Yes. So trying to get it associated with something so you'll remember. You've gotten 3 in the past. Yeah. And hopefully they didn't all count. Yes, I can post a link. Yep, no problem. So this was a diagnosis and medication questions. Very, recall, need to just know the associations. Okay, let's go to the next question. Okay, go ahead and put your answer in the chat box. Let me open it up. Finish up on the poll. Let me see how you did on the poll. Okay, we did pretty good. We did pretty good on the poll. This is a short one, but it packs a little punch, right? What kind of question is this? Community, absolutely. Community is talking about policy. Yeah, policy, community, I kind of lump them together, but yes, policies. So you want to create policies that will support service delivery to persons who are disadvantaged. Okay, so if you're creating policy, what is your first step of creating policy? Okay, so for this one, it's really good to remind yourself that you're creating these policies for a disadvantaged population. So you might need to know what you should write about, right? How would you know what to create if you didn't know what experiences or what problems they had? right? So the answer is D. So identify traditions that will be supportive to the service delivery. That is not necessarily something you would do first, right? Review current professional research related to the issues involved, but you don't know the issues yet. So how can you review the literature about something you don't know what the issues are yet? So I don't want you to assume anything. You can't jump steps. They break it all the way down. So you want to make sure you're putting this in order. Yes, I know it's a struggle. Community is terrible. Nobody likes macro practice unless you work in macro practice and then you love it, right? So ensure the policies demonstrate a commitment to social justice. Again, your distractor might have been something else. This was just I put this as the distractor because a lot of people might pick it, but your distractor could have been B as in boy, right? So the main issue you want to know is, does any of this come before? So if you pick B, let me see, what did people pick? Let me see. People mostly pick B as in boy. So if you picked B, you need to ask yourself, because it's the first question, does anything come before B? So if I'm going to go with B, I need to be sure that no other question comes before it. Yes, before you act, assess. I love that, Tasha. That's one of my principles that I go over in community, right? You have to gather information before you do anything. So you might have picked B because you're thinking I'm gathering information, right? But you don't know what issues they have yet because you haven't asked them. What do they have issues with? And then you might do some research about those issues, right? So it's just about really the wording. It was about the wording, and it was about making sure you know that before I create something, I need to gather information. And I probably should gather information by the population. That probably would be great too, right? So remember we talked about starting where the client is or involving the population, right? So I would say that's a principle too. Make sure you're starting where the client is and involving the population before you just jump and assume you know what issues are involved, and then research it and create policies based upon what you think the issues are, and not considering what the actual population says. Okay, so if there's any time where you are getting input from the actual population that's involved in the question, that's going to be the answer. Okay, I'll say it again. Anytime there's an answer or option that gives you the opportunity to get information from the population, you're going to go with that. That is better than getting the information anywhere else. You want to get it directly from that population, okay? Any questions on number 7 before we move on? What y'all saying on the Facebook? Okay. We're just gonna keep going. I saw some loves on the Facebook, so we're just gonna any tips on, okay, do you have any tips on community planning questions? Off the top of my head, community planning questions is to assess first. A lot of things that what time does this end? Well, whenever we finish. We're almost finished. It's only 3 more questions. So tips on community planning is to start with the client, to assess first. A lot of those things that we talked about with EPI today is going to be the same type of steps you're going to do with community. So sometimes it feels like community is really overwhelming, but actually it can be simplified, and that's what I do when we go over community questions only. You'll get more tips on it. Okay, let's go. Let's go to the next question. Number 8. All right, time is up. Make sure you put your answer. I saw some answers on Facebook. How are we doing? Okay, most people got it right. You guys are doing pretty good. So what you need to know about this question is the steps for program development. Write that down. And when I upload the video on YouTube, I'll list the steps for program development. I also have a video on my YouTube page about program development. So steps for program development. What did we say about the last community question? When you have a opportunity to involve the people that are impacted. Yes, involve the population, even if you didn't know anything about program development. Involve the population. It's going to be the answer. I'm telling you. Involve those residents, because before you implement a program, you need to design the program. It seems very like basic, right? But that's what they wanted you to know, that I was asked to start a program. So before I implement the program, I'm going to what? Plan for the program. I'm going to engage. I'm going to assess. I'm going to plan, right? All these things. Yes. Get information from the population. That's a good community principle. Okay. What if that part is in the question? What if it's in the question? Then you want to go to the next step in your steps of program development. Okay. So A, you're involving them in the design. There's things that come before the design, but that wasn't mentioned. I like that thought. Help me to answer this one. Good, good. I'm glad. That's what I'm here to help you answer the question easier. B, C, and D are all implementation. I'm providing something, that means the program is running, right? I'm distributing something, the program is running. A medical screening, I'm doing something again with the program. So before I do anything with the program, I have to figure out what are my goals, what do I need to run the program, what are my resources I need, you know, and I should be getting the residents' input into my design. Or I would be developing a program for myself instead of for the residents, right? All right, let's go to the next question. Yes, you'll be able to access the whole meeting or the whole session tomorrow on my YouTube, and I'll post a link on my Facebook tomorrow as well. Okay, let's go to question 9. We're almost finished, guys. I know it's late. Well, for me, it's 8:30, so it's kind of late. Okay, that was a minute. Hopefully you guys are doing good. Let me see. Okay, we had a little bit of split on this one. Let's go over this one a little bit. Okay. What type of question is this? Ethics. Population, this one was hard. Okay. What type of question is it? Hey, sour. Community, felt like community. That's because it was. Yes, community, a stressful one. Yes. Yes. Okay. So this is a community question. We have a group of people that feel like they are, I can see why you said ethics too, because they feel like they are, you know, they have concerns about them applying for government aid, right? So they are needing some assistance in this. Another principle with community, well, that was good. That was good. Another principle with community is when you are helping with your clients, it's better if they can do it themselves, right? Empowerment. So if it is between me helping them and them helping themselves, then it's always going to be to empower the client. So it's always going to be the right answer. So for this one, if you pick the extra social worky answer of empower, that's good. Yes, as long as they are stable, right? Yes, of course. If they are not able to empower, if they're not able to do it themselves, then you're going to advocate for them and of course help them. But because we have this community question, we're going to go with that. So it's not obtain legal advice relating to the client's concern because you're not a lawyer. You should not be obtaining legal advice. That's out of your lane. You're doing too much. You might refer them to a lawyer, but you're not going to obtain legal advice relating to the client's concern. You're not going to do that. Even though we do in real life, let me put that out there, right? We help our clients. We're super helpful, right? We would ask our, lawyer client, I'm not going to name any names, but can you help me with this situation type of thing, right? We do that. But for the test, you're going to stay in your lane. You're not obtaining any legal advice, okay? Discuss the issue with the social service agency director. You might have picked B too. That's a good answer, right? It's a good advocate kind of answer. Okay, so that was good, but it's not better than letting them do it themselves. Okay. And then respect the client's right to decide to withdraw their application. It doesn't say they want to withdraw their application. It just says that they are not able to be successful and they have concerns about getting their application, I guess, approved or whatever. So the answer is D as in dog. Any questions about this? Do you feel like I don't get why it is D? Okay, tell me what you thought it was, and then maybe I can help you on why it's not that. B, okay, you thought it was B. Discuss the issue with the social service agency director. Again, you've determined that the client's concerns are valid. So they're not just complaining to you for no reason. So the only principle that you need to know about community is that if it is me that advocates for them or they can advocate for themselves, you're always going to pick the best answer is to empower the clients. You want them to do it themselves. Now, don't get caught up on what you're empowering them to do. You're going to tell them to go to local officials. Maybe you're thinking in your mind, why wouldn't they just go to the social service agency director? Well, the point is you want to empower them. So if they were not stable, then advocate. Yeah. Advocating would be more about a social justice issue. Like if it says that they were being discriminated against and you want to go and rally, I said rally, is that what I meant? Protest or, those types of things, you would be an advocate, right? You would be standing up for those that can't stand up for themselves, right? A voice for the voiceless type of situation, right? But this situation is they're having some frustrations, they have concerns, and you're going to help them resolve their own issue. You're not going to take on the issue, right? Because what is your role? This is another thing. What is your role? Your role is that you are a life skills class teacher, right? Right? These are not your clients. Okay. They're not your clients that you're not working for the government agency and you're trying to help your clients get the government aid. right? You're not that. You are not just, but you're you're a great social worker, but you are doing a life skills class. So that's your role. So instead of jumping out of your role, but we do this in real life. This is why you're thrown off, right? We do this in real life. Like in real life, if my client says they have a problem with something that I have no business, not no business. if I have a client that says, hey, I'm having trouble in this other area, then normally, you're going to say, oh, no problem. Let me give them a call. But for the test, you gotta stay in your lane. And you're going to empower them to do it. You don't have to take this issue into your own hands, right? We kind of, we stress ourselves out a little bit, So according to the test, we need to empower them to do it themselves, okay? Is that clearer? It's not your role. You're not an advocate for government aid for foster care youth. That's not what you're doing right now. You're doing a life skills class. They bring something up that has nothing to do with your role. Okay. And this is a good thing that I want you. Okay. I'm sorry. I see something. But the agency director may have another avenue to pursue. I'm just a baby social worker and they need more immediate help. Okay. Now you're going a little too far because now you're saying that the agency director has another avenue to pursue. We don't know that. We don't know that. Okay. And then I want you to keep in mind that there are times where you are focusing on your client in your role and they will bring up other things. For example, let's say you are in therapy, right? A therapist provides therapeutic services, but they are bringing up a basic need. Okay, they're bringing up a basic need. Let's say they are cold and the winter is coming and they need a jacket. They're an adult though. They're not a child, so it's not a safety issue. Winter is coming, like in Game of Thrones. Winter is coming and they do not have a jacket. This is outside of your scope. You're not, you're not giving out coats, right? But you can empower them to go find out where there are coats, right? So that they can resolve their own issue. So again, you are doing your role, but they bring up an issue that is not part of your job speculation, right? It's not part of what you do. You're going to help them, but you're going to help them do it themselves. Okay? Does that make sense? In real world, we do everything ourselves. In test world, we're only supposed to stay in our lane. And we're going to help them, but we're going to help them by them doing it themselves. We're not going to take it on and call everybody and, do what we normally do in real life. Okay. Okay. Last question. I hope this has been helpful. This is our last question. I think it's short. It's kind of short. All right, your minute is up. How do you guys feel about the 60 seconds? Is it not enough time? What you think? Okay, let's see what's going on, the results. Y'all got this one right. Y'all, I got about 80%. 80% right. I like it. Yes, timing. Yes, timing is good. Study long, study long. I changed my answer. That was okay. Yeah, so it's okay. It's okay if you changed your answer today. Okay, it's okay today, but I want you to work on it. Timing helps, hopefully. How long should we take to respond to each question? I think if you do 170 divided by 4 hours, I think someone said it's a minute and a half, something like that, the math wise. And so there are questions where you'll see the answer and know the answer right away. And there are questions where you'll spend more than, okay, someone says 2 minutes. Okay, that sounds better. I'm like, oh, a minute and a half, 2 minutes. So 2 minutes per question. But I don't want you to think about it like that, because I want you to, this is just my strategy. Try it out first. Don't try it out on the test day. But my strategy is to answer all questions that I knew first. When I say no, I mean, I said, oh, it's definitely assess first. Like those ones that y'all got 90% right, because y'all was like, oh, that was easy. Do those ones first, because they build up your confidence and you don't need to spend a lot of time on them. You're like, oh, assess next, right? Versus the ones that are a little troubling and you need more time on them. So for those ones, I skipped. For questions, I had no idea, meaning they were a recall question, or there's nothing that I could ever know that would help me answer this question, right? Like, what is the prevalence of bipolar in men or women, or something like that? Some type of prevalence diagnosis question, a medication question, pick it and keep going. You know, if something, you have like a revelation in your mind, you know, later on in the test, maybe go back to it. But don't flag those type of questions. If you flag questions that you have no idea about, you're going to spend your 2 minutes is going to turn into 10 minutes. And then you're going to be stuck on a question that even after 10 minutes, you still don't know the answer. Okay? Don't spend a lot of time on those. So I answered all the questions I knew right off the bat, or the questions that I'm like, okay, I got it wrong. It's okay. Let me keep moving. Let me focus on a question that I can get it right? So that I flagged those ones, and then at the end, I went back and I looked at those ones that I flagged, so that I could spend all my time on those, and then that way I can spend 5 minutes on it, because I saved like a minute and 30 on the ones I already knew. Do you provide practice questions separate from your program? I do not have a full practice exam that is on sale currently. I'm working on it. I have questions in each session, but I don't have a standalone practice exam because I have to actually develop the questions, and it takes me a little longer. I have to develop additional questions that aren't in the sessions that we already have. So that's why it's going to take a little time. Okay, so let me see. I think we did pretty good on this question. Tell me what type of question it is. This question, really, the last sentence and the second to last sentence would have helped you. What kind of question is it? Human behavior? Yes, it is, because it's a cultural question. Yes, cultural questions are under human behavior, and we need to consider the culture of the fact that they are immigrants, and also the culture of the fact that it's the family culture, right? So the family said she cannot go outdoors after school. That's what they said. And so we should not be encouraging the parents to allow more independence. It's not our job to do that. We're not the parents. We're going to go with what the parents said. But we're going to fit our resolution within the parents' rules, right? So we're going to do C as in cat, facilitate interactions with peers during school hours, because we still have a valid concern. She's isolated and we need her to be involved in activities, but they're saying she cannot do any activities after school. So we can't do after school activities, but maybe we can do activities during school hours. Any questions on this one? Does it make sense? Yes, I like that. I'm not sure when you posted it, Monica, but yes, we should not focus on real world. You have to focus on the question. Oh, good. Built your confidence. That's what I like to hear. Yes, 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 yes. Okay, I don't see any questions about this. How long is the video up on YouTube? Forever. It's not going to go anywhere. And it's going to be on my Facebook after we finish. It's going to be on my Facebook. Okay, thank you so much for joining. This session is a glimpse of our questions section of each of my sessions. So when I do classes, I do an hour and a half on topics, right? So human behavior, I talk an hour and a half on human behavior. And then the last hour, we do go all the way till 9:30, and this one doesn't have the time. So my classes are from 7 p.m. to 9:30 p.m. Eastern Standard Time. Okay. And the last hour is what we just did. We go through questions. Tonight, we spent a little extra time because I had to explain it. When we go through the sessions, you'll be practicing the like method, and I won't have to stop and like explain the like method, if that makes sense. You get me live and you get to ask me questions live. For those that were not able to get into the Zoom, that problem you won't have for the actual sessions, okay? Because the sessions are paid, right? So it's just going to be the people that paid on the session. It's not going to be, oh, I can't get in Zoom because it's reach capacity. I can't reach capacity with the paid classes because it cuts off at 100. So because you have attended this session, you get a promo code for November 4th is our first class. You get $20 off. I realized after I gave the promo code that 0 and the letter O are very similar. And so when you type it in, just make sure you do 20 and then off in all caps with an O, not an extra 0, or you might have thought that 0 was an O. I'm like, okay, I should have made a better promo code that was easier, because some people were like, it didn't work. But that's because it has to be this exact format, 20 and then off in all caps. You're going to go to bit.ly/ASWS event in all caps, and it'll pull up all my classes. The first class, you'll get $20 off. If you have bought the bundle with me or have purchased classes in the past, live classes, especially the live class bundle, then you get some extra perks. Just email me. You got every question right? Woo! Yes. How did y'all do? Because I know. Now, you don't do math no other time, but tonight. Now, you're going to give me percentages. 67.9. I got a 67.9. I got a... It was out of 10, right? So it's a little easier, right? Yeah. And even if you got 3 out of 10, as long as you have that what I'm saying, as long as you learn something tonight is the point. What topic for the first? So November 4th is human behavior and diversity. We are going to, I wish I could come with you to the exam. I really do. This video will be on YouTube tomorrow. Give me until like the afternoon because I have a baby. So just give me a little time. 100%. Go ahead. 7 correct. Yes. 8 out of 10. I loved it. I did see your question. Don't worry about, was it yesterday, tomorrow, something? Yes, don't worry about yesterday. I saw your question on there and you asked, You asked about how to know how to identify the type of question. So it takes practice. So if you don't have time for that, just go ahead and ask yourself, what is the main issue? If you ask yourself what the main issue is, no matter what type of question it is, you need to know what's the main issue, right? So once you know that, you'll be able to eliminate appropriately without knowing, oh, this is ethics, oh, this is practice, oh, this is, don't get caught up on that. Is there a cutoff to purchase the class on November 4th? So the cutoff for every class is 6:55 Eastern Standard Time. So 5 minutes before the class starts. So if you're, forget about it until the day of, you can purchase it the day of, as long as there's still slots. It's 100 slots, so I'm pretty sure it's probably not going to fill up every time. How long is the bundle on sale? It's definitely going to be on sale this month, and probably until about November 15th. I'm trying to get my bundle, my replay bundle, on another platform. So once it goes on the new platform, it will be on sale for a little bit longer, and then it'll go up. So I would say you're safe until about the middle of November. My replay bundle, let me tell you the difference, okay? Before you purchase all my live classes and you already have the bundle. Everything is the same, okay? The bundle material and the live classes are the same. So I'm going to repeat it. It's the same thing, okay? So same questions, same everything, because I cannot keep creating new questions every time I give the classes. The reason why people like the live versus the replay is because you might have bought the replay, but you probably may not have watched it, right? Because you don't have a routine and you don't have a study plan and you're all over the place, right? So the live classes give you accountability. With my live classes, sometimes just like in the chat box, you kind of get to know each other. And then you might say, hey, Dana, I like how you're always on it and how you're a leader. And you might say, hey, does anyone want to do a study group outside of the live groups, right? So you kind of get that group dynamic that we learn about in school, right? So that's why the live sessions are good, because you want to get me live. You want to ask questions in the moment. You feel like with the replay, you don't get that live experience. And so you want to do live. If you don't care about talking to me live and you're like, it's okay, I just want the information and I want the information all at once, then the replay bundle is a great value because it is pre-recorded sessions from the last time I did the series for $70, right? So you can't beat it. It's really good, but it only works if you're actually going to be committed to watching and studying, right? So make sure. Okay, so those are the two different. How are the replay bundles formatted? It's the same, like I said, same thing, same recording, has the handouts. It has a lot of good information on there. It is on Google Drive right now because I'm trying to get it on a better platform. So Google Drive sometimes is not user friendly. So as long as you're okay with trying to figure out how to use Google Drive, and make sure you give me a Gmail when you sign up for the replay bundle, then you're good. We could do the promo code for the for the bundle deal. So the promo code is only for my live classes. It's not for the replay. The difference between the bundle and the live is I'm live and the replay is pre-recorded. So that's the difference. Okay, I'm glad you're more comfortable. Yay. I'm having trouble with sending it to my work to view iPad. Any suggestions? So if you have any trouble with any of my products, just email me. Sometimes what happens is you signed up with one email, but then you need another email. Like you said, you're at work and you need to see it on another email. And so it's gonna block you because you signed up with another email. So just let me know, I'll add the other email. but I'm not sure because I get a lot of requests for my email. I mean, for my to give people access that have not even, paid. I know y'all are passing it around. It's okay. But I mean, you're gonna have to get it another way. Okay, let me see what was on Facebook. Let me see. Questions. Okay. I purchased 3 classes already. Today I will get December sessions. All right, Nelly, can't wait to work with you. Your bundle has really helped. Thank you. I'm so glad it helped. Can you offer it for the 18th course too? The 18th? Oh, the code. So the code is only good for the first class. So the reason the code is good for the first class is because I want you to make sure you like it before you buy all the rest of them. But that's why I did the free classes too. So you can see my style and see if you're okay with it. Okay, let me see what other questions. Are the live classes recorded? Yes. So if you miss a paid session, you can still see it. And the answer is yes. The bundle is amazing. Okay, thank you. Thank you, Monica. Your replay is good. If I had finished it, I believe I would have passed. Yeah, it's a lot of material. The replay bundle is a lot of material. It's not really a material that you want to cram with. You kind of want to take your time with it and be able to finish it. You printed the material, made a binder. RIP to all the trees that you killed, but that's how I am too. I gotta kill trees. I need to have it physical. I need to see it. Does the bundle work for the clinical level? Good question, Chantel. So it does, but I always give a disclaimer that all my material is designed for the master's level. That means I was focused more on what is on the master's level exam. So in terms of the topics, you can buy the bundle because it's cheap. First of all, it's cheap. But you could buy the bundle, and there are some topics that are not on the bundle. But when you go to purchase it, there's a very long description that very few people actually read. And it will tell you the exact topics that I do not cover that for the clinical exam you should study. So like clinical interventions, I do go over them, but not in depth, like you need to know them. Differential diagnosis, I go over diagnosis, but I do not go over differential diagnosis. So you want to make sure you have another material or resource for those types of things. But it is designed for the masters, but you can use it at all levels. If you go on my Facebook page, there's actually a whole lot of reviews, and I've had a lot of clients that used it for the clinical. So, but it's up to you. I know some people are like, I want material specifically for my level of exam. And then also keep in mind that some people do, when they do like boot camps or when they do different things, they'll say it's for all levels because it's really a lot of content overlap, right? It's just about the percentages. And the clinical is more based upon intervention, whereas the master's level is more focused on assessing, engaging, and different things like that. Let me see. Does the discount work for each class? No, it works for the first class. If you have bought the bundle from me, the replay bundle, or if you have purchased live classes before, if you like did the VIP and you paid $197 or whatever else it costs in the past, then you get some extra perks and just email me. Do you offer private tutoring? This is a question I've gotten a lot. So I am considering bringing back my one-on-one tutoring. I was dead set against it, but my business coach told me that I need to be open to it. So you will get information on that. It will be forthcoming. I'm so glad it was helpful. Yay. How long should you study before taking the exam? So this is very much up to you. It's personalized. So it could be 2 weeks, but you don't want to chance it because you don't know if you're a 2-week studier. So some people do it and they pass in 2 weeks. I was not that person. I'm not comfortable with that. So it depends on your learning style. It may take you longer to retain the information. I always say 3 months is good, but it may take you longer. So just just see how you feel. Take some practice tests and see how you do. Okay, let me see. Anyone in the Philadelphia, Montgomery County, Philadelphia and Montgomery County? Because we have a Montgomery County. It's okay. That want to create a study group. Yes, create study groups, guys. That's helpful. Will the bundle come with handouts? Absolutely. Will you answer questions that come up while watching the replays? Absolutely. So that's why some people just go with the replay and then they ask me questions over email. Now, just keep in mind, it's going to take me a couple of days to answer your question. So it's not immediate like I would be in the live. So just keep in mind. The promo code is good for the first class. How much in total are all of the live classes? Good question. You know I'm not good at math, so let me get my calculator out. Okay, so the first class is going to be $20 off. And then if you buy 4 classes, right? So 3 at full price and the first one, $20 off. Then you get the next 2 free. I forgot to say that. Buy 4, get 2 free. Okay, so that's 37 times 3 equals 111 plus 37 minus 20 is 17. So it's going to be 128. But you have to remember that each class also has a fee of $190. That's only because I'm charged, each ticket. So 128. Okay. Then 190 times 4 is $7. So 128 plus $7 is $135. So to get me live for 6 sessions and 6 times 2.5, whatever that is, 6 times, anybody feel my pain? Okay, 15 hours. To get me for 15 hours, it's $135. It's not bad, right? Because you will pay that for a boot camp that only lasts 6 hours. Okay, just put it in perspective. Okay. Thank you so much. Hey, yep, replay bundle is amazing. Thank you. Yay, yes. Change. No. So my replay bundle has not changed since April. No. So if you bought the replay bundle this year, you should be good, but just email me just in case, and I'll send you the updated one just to be on the safe side. What's a good test score on practice exam to see if you're ready for the real exam? Great question. So for the ASWB online practice exam, which I suggest you take, it actually has a pass score. So a good score would be a passing one. But I have had clients that get just close to passing, and then on the real thing, they pass. So it's not a total wash if you don't pass the practice exam. There is hope. But the hope is that you do exactly what we did tonight, which is break down each individual wrong answer, figure out what did you miss, and write it down and make sure you never miss it again, right? So a lot of my clients have a lot of issues with first and next questions, right? Every time it's a first and next, they're getting it wrong. So my suggestion and my advice is that every time you see a first and next question, you need to remind yourself, I get these wrong, right? I need to put them in order. I need to slow down a little bit, right? So those are the questions where you might use your 2 minutes, right? Or your 1.5 minutes, okay? Any other questions on Facebook? This was longer than last week only because we went over questions, and we always kind of go over with questions because we're so excited and we need to know. I break everything down because I want you to come out of each session that's on the screen with confidence and feeling like you learned something and feeling like you can conquer the world. Really, that's the whole point. And even if you don't feel like that, you still have some anxiety, you still aren't sure about yourself, it will get better over time. It's a process. You're not going to be perfect the first time. Yes, that's what you gotta, I'm telling you, you gotta feel like you can knock out Mike Tyson. That's what I want you to feel like. That test is Mike Tyson, and I want you to knock him out. That's what I want you to feel like. So If you have any questions, you can email me. Okay. My attitude has changed. Yes, yes. Oh, I love it. Yes, your attitude, it has to change. You have to turn your I can't do this, I'm not going to be able to pass to that I can pass. Now, I understand that if you've had some failed attempts, however many they could be, it could be one or it could be many, that this attitude of I can pass may feel like you can never attain that attitude, but you got to get to it. Okay. How do you suggest studying for the crisis questions in the test? Crisis. Give me an example of a crisis. What do you mean? Are you talking about safety questions? Or give me an example. Many. It's okay. Safety. Okay. So a safety question is going to require a safety answer. So depending on the nature of the safety issue, whether it's child abuse and neglect that has steps and procedures, whether it's a suicide attempt that has steps and procedures, whether it's your client has a violent episode, those are the things I can think of as safety questions. So for this test, you are going to be all about steps and procedures. Okay. If it asks you what to do first, you're going to assess what have I already done to see where am I in the steps. Okay. This test is very linear. It's A plus B equals C. Okay. There are some situations where you're going to have different answers, right? You're not going to have the same answer for every situation that looks similar, right? Because the question may look similar, just like we had 4A and 4B look similar, but actually was asking you two totally different things, right? So you're not gonna be able to say every time I see this type of question, the answer is this, right? But if you have your steps and procedures, then you're gonna know, okay, well, I know that in this situation with child abuse and neglect, in this situation with suicide, I need to do a suicide assessment. Okay, that's the answer, right? Or if I've already done a suicide assessment, I need to know if the client has a plan. Okay, did I ask, does the client have a plan? If that's not, if you haven't asked it yet, that's the answer. The client says that they have ideations, but they don't have a plan or means to the plan. Okay, I need to do a safety plan. That would be the answer for that, right? So you can have the same situation with different things happening and different stages of the situation. So you just need to know where you are in that safety situation and to determine what to do to resolve it. So like that, those type of questions are going to be in November 11th, ethics and safety. We're going to go over all the good stuff. Any other questions before I sign off? Let me see. Let me go back on Facebook. Somebody on Facebook is from Philly. Just wanted to put it out there. Okay, I'm so glad this has been helpful. Again, if you missed any part of this, the recording is going to be on Facebook. It typically generates however many minutes after we finish. And then I also am going to put this on YouTube with all the links that we mentioned, the handout, and also other different things that I'm going to put, whatever we talked about tonight. If you have any questions at all, please email me. And I hope to see you on November 4th. It costs $17 plus $190, $18.90. Costs $18.90. So at the very least, hope I can see you on November 4th. But I hope I can see you every week. It's a really good experience. And it's formatted similarly to this. You can view the recording, so you can be like, okay, this recording is pretty good. You won't have a lot of issues trying to get in. It's not going to be, you're not going to have issues. But we're going to go through the information together, and I'm really excited. I hope you feel better, and I can't wait to see you on November 4th. Any questions at all, you can email me at info@advancedsocialworksolutions.com. The email is right here at the bottom. And if you don't need to hear my voice live, you can hear it every day on your recording, and you can buy the bundle for $70. Okay, see you guys on November 4th. And I will see you then. Oh, wait, I forgot. Why did y'all remind me about the drawing? Oh, Lord. Let me do the drawing. You don't have to be present. I just need to do it. I'm going to do it now. Okay. Let me go to my account. I'm going to download everybody that registered and put them into the name picker so you guys can see it. All right. Let's go with first name. Let's do the first name. Well, maybe not. We shouldn't do the first name. Let's just do the email. Because I'm like, oh, y'all might have similar first names. Okay. Let's just do the email. Okay. All right, we're gonna put all these emails into my random picker. Yes, drum roll. As soon as I figure out, okay, all right, let me share my name picker. I think that's right. Hold on. Okay, yeah. Share my name picker. Okay, so this is for all the gold. This is for the gold medal, okay? I'm going to choose 2 people that get all of the live classes for the free. I believe everybody is in here that registered, and I'm gonna say pick a random name, and it's emails. What happened? Oh, there it is. The winner is. Wait, the winner. I have to win. Okay, this is the winner. Let me write it down. I don't know the name because I just put emails in, but this is the winner. Is it anybody that's on here? Let's see. Yes, congrats to whoever this is. Congrats. Someone that is Cougars. I don't know what school this is, but that is an interesting thing. Cougars. CCIS.edu. All right. Okay, that's the first winner. Whoever that is. Okay, let's pick another one. All right. And the winner is whoever this is. Looks like Jessica. Oh, I don't know. Congratulations, winners. Whoever you may be. I will email you tomorrow. Okay, so we are officially done. Let me check. Was it anybody on Facebook? Everybody probably logged off by now. They're like, Dr. Boone, this is too late for me. I gotta go to bed. Me too. Okay, well, congratulations, winners. I'll be contacting you tomorrow. And I hope you enjoyed tonight. I hope you enjoyed tonight. I'm so excited to work with you all. Oh yeah, the stop share. Okay. I'm so excited to work with you all in the next coming 2 months, November and December. It's going to be great. So I hope we can all hang out together and pass this exam together. Let's do that. Okay, well, thank you guys again. Um, I will post this tomorrow on my page. I'm going to post the link and post the YouTube, so you'll be able to see it. And you can also see it, of course, tonight once we leave. So I will see you guys. It was so good hanging out with you tonight. All right, the live stream is done. If they don't accept, will you offer their spot? Yeah. Yes, I will. Meaning like I'll do it again, like the name thing, the random thing. All right, see you guys. Have a good one. Testing 1026. Come on, Tasha. Go, go, go. Yes, if you need any last I'm gonna say last words. Any encouraging words, I'm gonna post something this weekend to encourage you. Just in honor of those testing at the end of the month. You got it. You can do it. So see you guys. Have a good night. I'm hungry and sleepy. See y'all.